those who have chronic anxiety, panic disorders, for folks who have tried coping mechanisms. And I know, exposure therapy is something that seems to work, but for those who maybe are resistant to it, or it doesn't work for them, what changes need to happen in order to make real progress? Is that where we start relying on medication a bit more? How do you work with folks who have issues with those coping skills?
Well, really, it would depend more specifically on what the issues are. I think a lot of people seek out help for anxiety disorders, and look to get exposure treatment. I think the most common difficulty is the exposure treatment isn't being presented to them in a useful and accurate manner. It's common for people with anxiety disorders to deploy a whole bunch of what are called safety behaviors. Might be a superstition. They have a lucky shirt. They bring their lucky keychain with them. They prefer to pull over if they're approaching a red light and wait for the light to turn green and then get back in so that, there's avoidance. They may rely on a lot of reassurance, so I say to my spouse, you think I'll be okay and make it back home, all right, huh? Yeah, I'm probably not going to freak out. And right, yeah, okay. You're sure of that, right? It's okay. I think, I'll call you later. And so they rely on that kind of reassurance. The presence of any kind of a safety behavior, and here I would include, emotional support animals, substance abuse, whatever. When people rely on things to give them the feeling of protection, that undermines the exposure. Exposure that's done with a lot of safety behaviors isn't going to work very well at all. So that would be the first thing that I would look at. Not that it really doesn't work for this person, but there's something about the way they're using it that's self-defeating.